Our next taping technique is that for an MCL injury. MCL is a ligament which runs on the inside of your knee here, which can get injured quite often in sports. This taping technique can be used as a preventative technique or after an MCL injury. As you can see here, the most important thing is to get the position of your patient right, with the leg bent at about 30 degrees. They can be standing or perched over the edge of the bed here. It can be done lying down, it's just a little bit harder. From here, the first two anchors are going to be running just above and below the knee. It's important to be about 7 centimetres above the knee and about 7 centimetres below the knee. Don't do these anchors too tight, otherwise these big working muscles here can get restricted when playing sport. From here, going to be doing 3 strips going from the back of the knee to the front of the knee, and then 3 strips coming from more of the top of the knee down towards the calf there. Again, these will have approximately a 50% overlap on each strip. And then one more at the front. And there are those 3 strips. The other 3 will be coming from here, going diagonally in the other direction. And there's your MCL taping. The last bit is to anchor off at the top and the bottom. As you can see, the top and the bottom tapes had puckered up a little bit, but that's okay. That means the tape is nice and firm. There, a lot more neat and tidy. And that's the last part of your MCL taping.